everyone. Welcome to Tuesday at 10. We're so excited to be here at a pre-recorded event at Franciscan Alliance. And our guest speaker today is Sister Petra. She is a rock star. She's been here in the community for a couple of years, and not only does Franciscan give back to the community as a hospital, but they are fabulous at coordinating with non-for-profits like Doombrook with all kinds of services. So we are very excited to have some time to talk to her today. And of course, our primo reason for coming to was the dragon boat races. Last year, Sister Petra had a team, I think maybe two teams, with all nuns in their habits on the boats. So they were knockouts, and they have such great spirit and were so fun. So we are so excited to talk to her today, not only about how Franciscan Alliance is doing, which is fabulously well, and they are an anchor, really an anchor in our community, but also Sisters' experience and their team's experience with dragon boat races. So get ready, September 11th, 2021 for dragon boats next year, and watch out for a fabulous team from Franciscan Alliance. Thank you, and wait now to hear Sister Petra in person. Well, Sister Petra, thank you so much for letting us come and visit. The hospital is running so well and you're doing such great things, and it's just wonderful to see you. So, of course, we're talking about Doombrook and Franciscan's relationship with Doombrook, but maybe we could start off with talking a little bit about you. So maybe everyone can hear a little bit about what a powerhouse you are. And you've been here for how long, Sister?
All right, so my name's Sister Petra, and I've been here in Michigan City for 2 years.
2 years.
But I'm a sister of St. Francis of Perpetual Adoration, and it's my community that sponsors Franciscan Alliance as part of the Catholic Church's healthcare ministry. I live in Mishawaka, Indiana, where our mother house is, so I commute to Michigan City daily. I've been a sister for 12 years yesterday, so that was
congratulations on your anniversary.
So yes, I've been with the sisters for 12 years, but I've been mission to healthcare for 9 of those 12, and
nice.
The last 2 years here in Michigan City, which has really been a blessing. I mean, I've loved every hospital I've worked in, but there's something special about Michigan City, both the hospital and the community. There's all of our hospitals live our mission beautifully, but Michigan City, there's just this beautiful family feel, and there's something special here.
That's really nice to hear, Sister, and I do mean it. I know the hospital works with a lot of non-for-profits, but you have been instrumental and so energetic and so spirited in working with Doombrook and all the other non-for-profits. I just want to say thank you sincerely.
Oh, well, thank you for all that you all do, because I think us as Franciscan, we're one part of a community.
Yes.
So we provide the healthcare in the community, but we can't do our work ourselves. It's really us partnering with others in the community, like Doombrook and the programs that you do and the support that you provide us. I have to say thank you back, because you provide so much support to us, especially when we have families or children that come through our ER, or we see in-house where they're in need of your services. It really is such a gift to be able to have Doombrook as a resource.
Well, thank you. And I would think a lot of our listeners would want to hear how well the hospital is doing and all that they're doing given the pandemic and COVID. Can you talk to us a little bit about that?
Sure. So first of all, I have to say I'm so proud of our team here. I mean, they've really, from the beginning, especially in the early days in March and April when things really started to really get going in LaPorte County, our team did just such a beautiful job. I mean, their mission spirit, there's a lot of anxiety just in general about COVID in the community, and as well as just among everyone. But the way they handle that, and just still, every day, showing up, living out the mission, providing that loving, compassionate care in a time where families who came in were stressed. We had visitor limitations, so the staff really had to minister even more profoundly to patients, beyond just the medical care, but also being that support and that communication link to the families as well. And so really, our staff has done an amazing job. We've been blessed in that we've not had a single staff member who has, we've had some who've gotten, obviously people have gotten sick from throughout being in the community, but nobody in-house who has gotten COVID either from a patient or from another staff member, because our staff has just been so good about following our infection protocols with the masking, with the distancing, with the hand hygiene, the personal protective equipment, and our team has done an amazing job in making sure our staff has what they need to do their jobs. So, but I've just been blessed with, how our, it's been a blessing to see how our staff just dove right in and has provided such amazing care in a time when there's so much uncertainty and anxiety.
Right.
And even, I don't know if you've noticed when you drive down 94, you'll see in the windows, you'll see these murals of hearts where one says love, one says faith, one says ICU, and the staff took that upon themselves to put these messages of encouragement out to the highway, by cutting out these hearts and laminating all of them and putting those in the windows. And another unit, the staff cut out hearts and put notes of encouragement hung on every patient door. So just to see that, the ways that they found to show that, our Franciscan value of that compassionate care and that respect for all of our patients, in their own way of living on that mission.
Well, I have to tell you, that's very comforting. I mean, just when we walked in today, they're very kind and they know you're a little nervous coming in, and just their attitude is so positive. So I would say thank you to that.
Thank you.
And know that the protocols since March or when it all started have kept you so safe. That's wonderful to know.
Yeah, and our staff is, and again, we couldn't do it without our staff. They've just done an amazing job.
Well, thank you, Sister.
And the community's been so supportive too. When all this started, we've had so many messages of encouragement, support, prayer. We've had people donate food. We've had people donate. We've had funds donated to help provide equipment to our staff. We had over 10,000 handmade masks donated that we've used, we've sterilized and then given out to either staff or to patients who didn't have a mask to be able to wear. And so just the outpouring of support from the community has also been beautiful, and our staff has appreciated that because they realize that that the community is grateful for the work they're doing on the front lines, and that I think we have to say thank you to the community, because that support, I think, provides the energy and helps keep our staff going.
Right. Well, we really appreciate you, and we appreciate the entire staff, nurses, doctors, janitors, everyone, because we know in the crunch it was difficult at first. It was very, very difficult and very scary. So as you said, your whole team rose to the occasion, so thank you. But speaking of teams, of course, we're here to talk about the famous Doombrook Dragon Boats. And Sister Petra was quite the spirited team leader last year. Can you tell us about your experience with Dragon Boats?
So one of our nurse directors, Sarah Jones, is on the Doombrook board, so she brought the idea of the Dragon Boat races, and we've done it every year, but it was the first time I had heard of it, and I was just excited about the thought of, I've never done that before, and it sounded exciting, and so I said, well, we were trying to get as many staff as possible involved, and I said, well, I'll get a team of sisters to help to be in a boat, and so I mentioned it to the sisters at the Mother House, and I had, so many say that they wanted to be a part of it. They were so excited, and including we had one of our sister paddlers was over 80 years old, and she paddled all 3 heats. I kept saying, "You sure you don't want to rest?"
Right.
And she was disappointed that it was had to be canceled this year because of COVID, because she was ready to sign up again. But able to support Doombrook's mission by being a part of the Dragon Boat races, but then also for us, we had. I think we had close to 100 staff members that signed up, to be, or just were there to support those who were paddling. Just the ability to be there and witness, because one of our values is joyful service, and so that Franciscan joy and that joyful spirit, to be there and witness to that, and was just a lot of fun. I mean, and several of our sisters who aren't in healthcare that came from the schools to help support us, they were asking too if they could sign up again for the next race. but this year, but I have to say, I saw someone took a video of us paddling. We were dead last in all 3 heats. But we looked like a little bug out in the water trying to go. But it was fun. It was a lot of fun. And I would love to say that next year will be, this Brown will beat the other Brown UPS. So we saw them fly across the lake. There's no way we're beating them.
Well, we think you're number one, sister. Honestly, in spirit, it's unbelievable. And can you give the visual to all of our listeners, the visual of you all in your habits?
Yeah, so we're all, because we as sisters, we always wear our habits, even when we're, like basketball, volleyball, and we
Sure.
were paddling a dragon boat, so we were,
Right.
all in our habits with our life jackets,
Right.
and out there paddling,
Right.
and it was.
But how symbolic, Sister, that was of your, sincerely, all of your team and the spirit they have. Not only physically were you doing something healthy, but, emotionally and spiritually to be giving back to the community. And that was, I have to say, that was so symbolic, not only to all of us there, but everyone watching. So thank you.
Oh, thank you. I mean, that's, for us, it's, part of our, I think, for any sister that's missioned either in healthcare or in our schools, it's our witness to the love of, to the love of Christ, and to that's our main job. I mean, because the work we do, people who are not sisters can do as well, but we bring that witness of our mission and our ministry, and so that's the important part. So, but yeah, we had a blast. And it was funny because I think one of our, there was somebody from one of the boats, we had 3 boats paddling, that said, they were too tired, they didn't think they could do a second or third race, and one of our nurses who was the team captain said, I've got an 8-year-old nun out there paddling all 3. You can get out there and paddle another race.
If we can do it, you can do it.
But it was a lot of fun. I mean, and the whole day was just it was very much a family affair, which was a lot of fun to see too. Everyone seemed to be having fun.
Yeah. And the camaraderie, would you say, Sister, amongst your participants and your team, the camaraderie during and after?
During and after, yeah, in between, because we had, people brought food and snacks, and, and just a lot of, the people, our staff came, they brought their families with, and it was such a beautiful day. The weather was amazing that last year. But just, it was almost like a family picnic. It was so much fun. Yeah.
Right, because I think we have about 800 to 1,000 total on Stone Lake in LaPorte. So next year it is on September 11th.
Oh my goodness.
We can't forget that date.
Yeah,
so September 11th, 2021.
Okay.
So we will wish you well in your team. Or teams, and we're just, Sister, you're such a dear. Thank you for your spirit and all that you do, most importantly at Franciscan, but for our community and also for Dunebrook.
Thank you, but like I said, it's we're partners with the community, and so and it's it's such a beautiful community, and I've loved every minute that I've been here, and to be a part of. There's a lot of amazing work that happens, both the work that Dunebrook does and others in the community, and it's really beautiful to be a part of that. And for us, with Franciscan, the desire to be even more in the community, because we realize that healthcare is not just within the 4 walls of the hospital. Healthcare it's the health of the community, and so how do we be partners in that to address the overall health, but also to address some of the disparities in healthcare in the community, and what's our role in being able to bring those resources to the community.
Great. Well, we appreciate you, Sister Petra,
thank you.
and we appreciate Franciscan not only for everything in the hospital, but how supportive they are of Dunebrook and all the other non-for-profits in the area. So thank you so much.
Oh, thank you.
Do you have anything else you might want to mention to the community about anything with the hospital?
Just a couple programs that we started.
Sure.
So we've launched in partnership with the Salvation Army a food prescription program.
Yay.
So that's it's a pilot program, and we're working with our Diabetic Education Center and Salvation Army, where we're identifying individuals that have their diabetes is not well controlled, and they screen positive for food insecurity. So what we're doing is that we're giving the option to enroll in this program that includes education as well as some coaching and case management, and then in exchange for being a part of that, it's a 6-month program that they get weekly supplements of healthy food. Either they pick it up at Salvation Army, or it's delivered to them if they have transportation issues for their household, because we realize if the individual is screening for food insecurity, their household is also struggling with food security, and so then we and if we give them any food to the individual, it'll be likely shared with the household. So we adjust the amount depending on how many are in the household, and so we'll be excited to see how that will be. Anyone who enrolls in the program will be testing their A1C scores, and looking to see is the education and the supply of healthy food and some tips on how to prepare it and use it, will that help improve their overall health outcomes and in
Yeah,
terms of how
that's
they're managing their
wonderful.
diabetes.
So if someone's interested in finding out more about that program, Sister, they should call Salvation Army?
Or either Salvation Army, or they can reach out to me as
hospital.
well.
Okay.
And we can, you know,
Okay.
and get them connected. It's patients that are being referred to our diabetic education program.
Oh, perfect.
And then they're screened and then referred to the food prescription program.
Wonderful.
So,
And did you have another one you were gonna, was it just the Salvation Army one, or was there anything else?
I know we've got a lot going on.
Yeah. Right.
But the food, I would say the food
Great.
prescription, that's one of our
Okay.
new programs. And then, also what we're doing at our legacy campus in terms of, we'll be taking down parts of the old building, but the newer part of the building will be relocating our behavioral health program there.
Oh, wonderful.
As well as having our, what's it called, the PACE program, which is the program of all-inclusive care for the elderly. So it's for elderly patients who are both Medicaid and Medicare,
Yes.
who don't have caregivers at home, but have someone at night that can help provide care. So this is an opportunity, a place for them to go during the day, where they also receive their health care. So if there's any therapy needs they have, any other health care needs that they have, that's
Wonderful.
provided as well. So the goal is to keep them, so they don't have to be sent to a nursing home or assisted living. They can stay at home, but have somewhere during the day where they're, so that program will be going in there as well.
In the old hospital.
In the old
Yeah.
hospital.
Oh, that's
So
wonderful.
in the process of doing the renovations that they need to prepare for that program, as well as for the to moving our behavioral health unit there, and then we're looking at other partners for other space in the hospital.
Sister, that's wonderful. What a need in our community.
Yeah.
Yeah, that's wonderful. Well, thank you again, Sister. What a delight. Thank you for your time today.
Thank you.
And we'll wish you all the best on next year, September 11, 2021.
We'll be there.
All
We'll
right.
be there, and I my goal is to have, we were just shy of full boat of sisters, so my goal is this year to have a full boat, because
Great.
we told ourselves that if we had been all sisters, we would have won, but I don't think that was the
There you
case.
go. The
We tried
karma.
telling ourselves that.
Right.
Yeah.
All right. Well, thank you, Sister, very much.
Thank you, Sister Petra. Of course, is she just the best or what? And thank you, Franciscan Alliance, for being so supportive of not only Dragon Boats, not only Doombrook, but our entire community. So if you, like Franciscan, would like to support Doombrook and specifically the Dragon Boat races, just go to our website, doombrook.org. There's a big old dragon on there. Click on the dragon, and it's very user-friendly. You can also text, and Megan will have that on the screen in order to text a donation. And any donation is so appreciated. 5, 10, 15, 100, a million, whatever you have is so appreciated, because in order to keep our services going, we really are funded 30 years old, Doombrook, by not only some state programs, but fundraising like the Dragon Boats and our gala, and also grant writing. So we appreciate all of you. We appreciate the recognition of keeping our children safe and healthy and happy in this community through our Healthy Families program, which sees 140 families a month with positive parenting skills. And yes, we are doing that virtually. Also, our public education, where we go into the schools. Having been a school person, I love this program where we empower children to say, that's inappropriate touch. And if something happens, how can you get help? And lastly, in our original program was our Child Advocacy Center, where we actually interview children of suspected cases of abuse and begin the healing process, not only for that child, but for that family. So thank you, Sister Petra. Thank you, Franciscan. And go Dragon Boats 2021. Thank you.
Be kind to yourself.
Oh, and lastly, my famous line, especially during this time of COVID. Thank you, Megan. Be very kind to yourself. It is a funny time for sure. Some days we feel like we've got it all going, and other days you just wonder how we're going to make it through. So be kind to yourself and be kind to others. Thanks again, and have a great day.